Okay, hi everyone. Ladies and gentlemen, it's my honor to be here to share with you my ISF study. My topic today is I would like to update with you the ISF outbreak in Vietnam during 2019 and 2024, what we can learn from the outbreak. So as you know, I'm professor from Vietnam National University of Agriculture, College of Veterinary Medicine. Here is my email address. If you want to have any contact, yeah, it's welcome. So my topic today content, I will share with you four different sessions. The first, I would like to update with you the big population in Vietnam. And second is generation information of ASF. And the third one is molecular detection and pathology characterization of ASF strain circulating in Vietnam. And the last one is control measure applied in Vietnam right now. So the big population in Vietnam. So, as you know, the ISF entered Vietnam early 2019. At that time, the big population in Vietnam, as far as I know, about 30 million. But you know that in Vietnam, pork meat is the main consumption in Vietnam, contribute to 70% of the Vietnamese meal. Because of ASF, so the Vietnam pork supply structure changed a lot. As 2019, as you know, in Vietnam, two kind of animal raising system, company raising and backyard family raising. 2019, the ratio about 51, 49%, about the same. But because of ASF, so the backyard family or family raising very hard to suffer from ASF, so change a lot. So as a data from update from last year, so backyard family decreasing very soon. So of course, company farm more investment. Of course, now there is a big population increasing year by year, but right now I think very difficult to maintain the herd. As far as I know, about 25 million heads of pig right now about. So here's a trend of pig price during last year and earlier this year. You can see because of the ASF, so not easy to maintain the pig herd. So right now, I think it's good pork price. The data 4 months ago, the pork price for live kilogram about 76,000 Vietnam dong. It's about 2.8 US dollar. But right now, I think about 2.5 US dollar per live kilogram. For the ASF history, as you know, the first outbreak reported in Kenya more than 100 years ago. But as my understanding, the ASF outbreak become international concern when the ASF virus entered Asian countries. The first reported from China, August 2018, and then spreading to whole every Asian country, including Vietnam, Philippines, every country. So until now, only Japan and Taiwan, there's no report for the ASF. Why is ASF so dangerous? I would like to tell you because the virus belongs to double-strand DNA, very big and very huge virus genome. And the virus causes a very high contagious and hemorrhagic disease of pig, and on big species and on age of pig get infected and disease. Mortality rates up to 100%. Important thing is the virus is very diverse. Based on genetic sequencing, there are 24 different genotypes in worldwide. Of course, different genotype, different virulence. High virulence can cause a big death, 100%. Low virulence, just zero conversion. The important thing is the virus attack to the immune cell, so the immune system is affected. So when the ASF virus infects the pig, immune system is affected. So many co-infection and secondary infection, bacteria or other virus infection, so cause a big health status down. The symptom of the ASF is very diverse, depend on the different strain. As I mentioned, 24 different strains classified. Incubation time depend on the strain. With a high pathogenic strain, incubation time very short, about maybe 1 week to 3 weeks incubation time. But low vigilance, of course, depend on the virus strain. Some strain enter the infect to the pig without any critical sign. You know that there are four different forms of the disease. For case of in case of the ASF from early infection in Vietnam, look like 4 years, 5 years ago, I just see the acute and per acute disease, but right now I see four different forms in Vietnam: per acute sudden death, and acute and acute and chronic. So it means the disease very complicated. The important thing is the virus very high persistent to the environment condition. On common processing meat is not enough to kill the virus. You can see here the sown meat, the virus can survive nearly 200 days. Even dry meat also 300. Also, the virus very high resistant to the physical and chemical action. For example, the only low pH lower than 3.9 or very high pH over 11.5 can kill the virus, and also the virus can maintain survival long time, long period in blood, feces, or tissue chamber, especially in cold condition. Even freezing condition can look like a very good condition to preserve the virus. So in my lab, because my major is virology, I'm the virologist. So since the disease happened in Vietnam, very soon we have a virus isolate. So my lab, we are very good at in vivo and in vitro antiviral or any vaccine candidate. We have many experience. So until now, my team, as you know, my team is the first to detect ASF in Vietnam. So until now, we published more than 30 publications in Vietnam. So here's some representative paper of mine. The first one I would like to update with you based on molecular characterization, what trends in Vietnam. So as you know, the virus, the first reported in Vietnam, the early 2019, is the North Hưng Yên province in Vietnam. As the government says that only 7 months later, all 63 province in Vietnam reported. At that time, the government said that 6 million pigs is cool. But at my observation, the big die and cooler, maybe double, maybe more than 10 million pigs die of ASF. As I mentioned, ASF virus belong to 24 different genotypes. At that time, based on my sequencing data, the virus belong to the genotype 2. So here's some of my publication. If you want to see, you can contact with me, and then I send you the whole paper for your reference. Right after I have a virus, I want to check the pathology of the virus. So I use 3 different dose of the virus. 10 to the 2 is mean very low dose, and 10 to the 3, 10 times higher, and 10 to the 4. So here is the first picture. The meaning is during my experiment and the field observation, fever is very typical clinical sign of the ASF. Of course, depend on the virus strain, but most of the virus, when the virus infect to the pig, fever is the most typical. We can see, but the B picture means the virus very high vigilance. I use 3 different dose, 10, 2, 3, and 4, but on the big die, even 10 to 2 dose, very low dose, but on the big die within 13 days. So of course, higher dose, the shorter mean death time. So here's my paper for your reference. Of course, my major is virology, so I try on my best to do many sequencing of many virus samples. So during my work, so all the virus strain belong to the genotype 2. Among, as I mentioned, 24 different genotype, but genotype 2 is the main virus cause disease in Asian country in Vietnam. Of course, as I mentioned, I did a lot of sequencing. So virus itself also, there are many mutations happen. So it's easy to understand because the virus kind of parasite. So a virus mutate itself during the time of circulating. Besides the detection of genotype 2 is very high vigilance trend. In my lab, we detected a lot of gene deleting strain. But what is the meaning of the gene deleting strain? Gene deleting strain is meaning that for the ASF, scientists know that many genes related to the virulence of the virus. So scientists try to delete some different gene with the hope that if they can succeed to have a low virulent or attenuated virus strain in order to have a vaccine strain. So that's why different scientists they delete different gene, and then maybe after they have a virus candidate strain, they try to find study so maybe and then the virus setting to the outside. So it means that in Vietnam, until now, I detected many low vigilant strain. But this strain is a gene-limiting strain called the chronic or subchronic disease. Yeah, I'm sure in Vietnam, no scientist can master the gene editing technique, but it means on the gene editing strain called the low vigilant. It's a low vigilant strain called the chronic disease coming from outside Vietnam, not in Vietnam. So here's a paper related to the gene editing strain. One thing, of course, I don't know if you are scientist here or not. The virus can absorb the Z blood cell. So during the virus isolation on the cell line, we can add the Z blood cell. If you can see the hema absorption, it means the evidence of virus replicate into the cell. But in my study, I detected many virus and success virus isolation, but I didn't see any hema absorption. It means many strains circulating in Vietnam, gene editing strain. As I mentioned, my lab, I have many virus isolate. So one of the study I conduct the pathology of the one gene editing strain detected in Vietnam. So I use the oranation rules when I test the gene editing strain. I set up the experiment using 6 different piglets, 6 weeks old, and oranation infection. But important thing is the side effect happen. After 1 week, 5% pig gets a fever, but the 12 day, one pig die. Of course, the remaining pig become healthy, and after that, I do the challenging on survivor. But what is the meaning? From my experiment and observation, every vaccine after vaccination side effect look like fever or shock always happen even 1 hour or 2 hours later. But in case of ASF, even vaccine side effect always happen and seen after 1 week. Yeah. So this data means that the gene deleting trend. Of course, I did a whole sequencing. So this one very 100% similar to the ASF vaccine strain developed from USDA America. So it means this strain is not safe enough. Of course, the protection is good, but not safe enough. One big die. So here's a publication of mine. You can see. So it means this vaccine strain circulating in Vietnam is not safe enough. Vaccine-like strain, not vaccine strain, because it's not. We don't have evidence to say vaccine strain. Vaccine-like strain. Of course, here's a very new update paper, also coming from Vietnam. Some practical doctors, they see the reproductive failure of the Vietnamese breeding herd, and then they try to isolate the virus. So based on sequencing, they see that the virus belongs to the gene editing strain, look like vaccine-like strain. So the whole sequencing the same origin ASF vaccine candidate strain developed from America. So based on their observation, the breeding, especially the sow, have a high abortion and stillbirth and affect to the farrowing rate. And this study evidence shows that the vaccine-like strain setting to the environment. And also this study demonstrates that the evidence of vertical transmission from the sow to the piglets through the placenta. Yeah. So besides the high vigilant genotype 2 and low vigilant gene editing strain, so my study, I also detected many recombinant ASF virus strain. What is the meaning of recombinant ASF virus strain? As I mentioned, there are 24 different genotypes, but in China, 2021, they detected the recombinant the first time in the world. It means the virus genome carry both genome from 2 different genotypes, genotype 1 and genotype 2. So important thing is this for the recombinant strain, the vaccine is not protective because Vietnam, we said the long border with China. So my study I try on my best to survey what virus strain circulating in Vietnam based on genomic sequencing. The data from my report didn't publish yet. So the first detection of recombinant strain from May 2 years ago. So as you see, by the time the ratio, the prevalence of this strain increasing very soon. So red is mean genotype 2. So here green is the genotype recombinant strain 1 and 2. After my detection, I did the whole sequencing. So virus strain circulating in Vietnam is 100% similar to the recombinant virus strain circulating in China, as I mentioned. The report from 2021, 2 years later, I detected in Vietnam. So by sequence, whole sequencing, genomic sequencing means that the virus strain coming from China. So here's my update data. So important thing here, you can see 2 years ago, the recombinant strain circulating just 14%. But here is last year data. So recombinant strain increasing 42%. So it means, as I understand and at my observations, the pandemic in the near future in Asian country or worldwide will be the recombinant strain. But the important thing is this strain is very high virulent. I also test in the animal model. I use 3 different dose, 10 to the 4 dose, 10 to 3. It means 3 different concentration of virus. And then I inject to the experimental pig. So 10 to the 4 on the big die within 6 days, 10 times dose lower, 10 to the 3 on the big die within 8 days, and 10 to the 2, which means very low dose, on big die within 10 days. So here's some of my publication of recombinant strain detected in Vietnam and whole sequencing. Important thing, the recombinant strain. I tested in Vietnam. As you know, Vietnam, we have 2 commercial ASF vaccine already. Recently, one more company licensed a vaccine. It means Vietnam nowadays, there are 3 different vaccine license and commercialization in Vietnam. But I tested the vaccine with this strain. So anyway, this recombinant strain, the vaccine is not protective. So it means the vaccine only protects the genotype 2 homology protection, but with the recombinant strain, vaccine is not protective. So it means even if you did the vaccination, the outbreak still happen caused by this recombinant strain. So my paper we published already. Here, I would like to show you how the ASF outbreak spreading in Vietnam. So we do know that Asian countries, including Vietnam, Thailand, Philippines, or other, even China, we have a traditional market. So many ways to bring the virus enter the farm. So you can see many ways, even coming from visitor and local market, even from mixed product, many. So many ways, because I think the local market is the main source of the virus. So it's an issue of Asian country. Important thing is we do understand that 2 kind of raising system, animal, company raising and family raising, but family raising, because of local market, people can bring anything to the market to sell. So very hard to any government to control the meat trade, right? So I think, but anyway, the local market is the main source of the virus spreading and maintained for a long time. So question is, if the virus enters the farm, how about the transmission? The virus within the farm is it fast or slow? So my study, I send my student to the farm, infected farm of ASF. So daily gather the information, the transmission, the death, and clinical signs. So anyway, ASF disease transmission very slowly compared to other disease, look like the PERT or FMD. So it means early detection very important. Of course, different farms transmission low or high depend on the farm and farm, because different farm, different biosecurity and different epidemiology. So anyway, the virus, the disease very slowly transmission within the farm. So early detection is very key. If you can detect the virus, detect the disease very soon in the farm, you can apply the isolation and disinfectant, and it can still keep the herd. So as I mentioned, because the virus, there are many strains, including in Vietnam, I think Asian countries are about the same picture of the disease. So the diagnosis also changed. From beginning, as I mentioned, the virus belong to high pathogenic strain, so called acute and subacute. So when the virus enters the farm, we can see clinical sign very clear. But right now, because of many low vigilance strains circulating, even without any clinical sign, so from beginning, in case of high vigilance, you can use a molecular method, look like real-time PCR. But right now, only real-time PCR is not enough. We need to combine with a serology test, look like ELISA. So this data means that, of course, many samples can be used for ASF detection. But based on my data, because we use a real-time PCR, so we know the CT value. CT value is means the cutoff value. CT value low, it means the virus load is high. Yeah. So in case of high vigilance strain, the CT value about 20, but low vigilance look like vaccine-like strain. CT value very high, it means virus very low. So even sometimes we detected the virus in the farm without any clinical sign. Of course, at that time, the CT value very high, about 35, 36. So I think any clinical doctor, when they see the region, the report from the diagnostic lab, they can see the CT value. So it means CT value low, it means virus load very high, and CT high, it means virus is mean low. In case of low vigilance strain, we cannot see clinical signs, so only using ELISA method to monitor the antibody. It means 0% we know the virus infection or not. So we also, in my lab, also we develop many methods to detect ASF in Vietnam. So anyway, from this slide means that we cannot diagnose ASF based on clinical sign only. We need to combine clinical sign and then a lab test. But lab test, we need to combine both methods. Real-time PCR, like molecular detection of the DNA of the virus, and the serology test, like ELISA, to monitor the antibody. Because some farm without history of vaccination, but no clinical sign, but sometimes the sour look crisis, so the virus detection sometimes positive, sometimes negative, but in case of ELISA testing, in that case, it's also always positive by antibody. It means the strong evidence that the virus enters the farm and infects the pig. Here's the data also. Actually, as I mentioned, my lab, we did a lot of ASF study. So this study means I want to survey the virus distribution of different organs. So this means that the whole blood, the virus in the whole blood, very high titer, the very high virus concentration. Got ingredient lymph node also very high. So means that the whole blood of the infected pig, very high virus concentrations. So the suggestion is never do necropsy, because if you do necropsy within a farm, so the blood setting is means the virus setting to the environment. So it means very hard to control. So the suggestion is never do necropsy within a farm. Yeah, we publish a paper also. So suggestion for sample, because sometimes, as you know, I'm professor at university, so I receive many phone calls because the farmer says that, oh, they have a clinical size so big, so what sample suitable for collection and ASF detection. So I already recommend in case of live survivor pig, just collect the whole blood is suitable. But in case of death, we cannot collect the whole blood. So the suggestion is that we collect the ingredient lymph node, because we just touch the skin and touch the lymph node here without any blooding to prevent the setting of the virus to the environment. So very good, sample source for any for virus detection. So here's my summary slide. So as I mentioned, from beginning outbreak in Vietnam 5 years, 6 years ago, the virus very high acute, very high pathogenic. So the big death very soon, within 10 days, 2 weeks at that time, because of big death very soon after infection. So antibody is not enough time to induce. So ELISA test always negative. But at that time, if we collect the whole blood CT, the qPCR always, real-time PCR method always have a positive result. But the CT very low, as I mentioned, CT very low, which means the virus load very high. But nowadays, as I mentioned, many virus circulating in Vietnam. So the virus got a longer incubation time. So in case of sub-acute, so incubation time of the disease longer after 10 days, 12 days. So at that time, the enough time, the time is enough to induce the antibody. At that time, if you combine both methods, real-time PCR or ELISA, both methods will give the positive result. But here's the question, in case of low vigilance strain, as I mentioned, low vigilance is even the same virus, very low vigilance, but different farm, you can see clinical sign or not. For example, some farm, if the pig very healthy, the virus low vigilance strain enter the pig, you cannot see clinical sign. So at that time, if you test by real-time PCR, will be negative. But at that time, if you test antibody, it will be positive. So it means by low vigilance strain, you need to combine both methods, real-time PCR for DNA detection and ELISA method for antibody detection to conclude the infection or not with ISF. Yeah. So CT value, as I mentioned, even positive by real-time PCR, but very high CT value. Sometimes it's a negative, but at that time, you need to combine with the ELISA method to confirm it's an infection or not with ISF virus. So here's a summarized slide. So what strain circulating in Vietnam? I compare with China. So because Vietnam and China, we share the long border. So whenever the China, there is a new report of the new virus strain circulating. So I try to survey in Vietnam. So anyway, from the first outbreak caught by Chuntai Chu, very soon in Vietnam, my study detected and whole sequencing says that Vietnamese strain very 100% similar to China. And then China also reported the genotype 1 called chronic disease, but I don't know why in my study and other report in Vietnam, no one detected the genotype 1 virus strain called chronic disease in Vietnam until now. But here also, besides the natural strain, China also report recombinant strain genotype 1 in genotype 2. Very soon, my study also detected. So China, they also report many gene-deleting strains called the low vigilance and called chronic disease. Vietnam also detected. So look like the picture very the same. So here's the last I want to share with you what we are doing in Vietnam to control the ISF and to prevent the ISF. Of course, in Vietnam, I think Asian countries the same. Many potential risk factors affect to the ISF outbreak. In Vietnam, I think, as I mentioned, the same Asian country, very hard to control the big movement and trade practice, very hard to control the movement and trade of animal and animal product across national border and even within the country. And also, smallholder and backyard farm often trade live pig through the informal kennel without veterinary oversight. And important thing is on the farm in Vietnam, very old farm, although more than 10 years, it means very low biosecurity. It means very hard to apply any biosecurity method to control the disease. And also many farm within the farm, they share the equipment, vehicle, and personal. So it's also the way to spread the virus within the farm. So here I'd like to show you the prevention and control of ISF at the government level. But here's the government suggestion. Of course, biosecurity very important, and early detection very important, and partial cooling. I don't know if you know or not, in Vietnam, policy we change a lot from the early outbreak. Vietnam government we suggest policy in case of the farm only one case infected and positive cooling and stemming out on the big in the farm, but after that very damaged. Many pigs die, so the government will change the policy. Even the same farm, if the clinical site shown one pen, just stemming out the infected and clinical site shown big, we can keep the healthy pig even in the same farm, of course, under monitoring. Of course, government also nowadays, even right now, they apply very strict movement control and public awareness. And the government also recommend vaccine program because in Vietnam we have a vaccine license vaccine and commercialization. But in practice, here's industry level. As my observation, is a prevention strategy of any company farm. Of course, biosecurity, strict biosecurity, very important, and they always have active clinical site monitoring. In Vietnam, on the industrial farm, they apply this triangle and tetting removal. Every farm they have active surveillance. Even right now, as far as I know, even government announcement, vaccine suggested to use, but almost company farm they try to use a negative farm, so without vaccination. So they always have active monitoring. It means like 2 times or 3 times per year they collected the whole blood of the breeding farm, the sow, and sent to the diagnostic lab for antibody detection. In case of antibody positive, removal, even without clinical sign. Yeah, of course, in case of sick and death, they try to get a sample sent to diagnostic company for diagnosis. So I think this method structure is good in Vietnam. So many companies they can keep the herd. So anyway, internal biosecurity is a key factor to protect the big farm from ASF infection, and early detection and internal biosecurity is the most critical element in the preventing the spread of ASF within the farm and on farm in Vietnam, and testing removal. So anyway, early detection and testing removal is very important to keep the herd. So what lesson learned from the outbreak in Vietnam? As I mentioned, many virus strains circulating in Vietnam. Of course, clinical signs, as I mentioned, very, very diverse, depend on the virus strain. In case of genotype 2, very high vigilance causes acute disease, mortality rate in 100%. But recombinant, as I mentioned, carry both genomic sequencing of genotype 1 and genotype 2, also very high vigilance, not related to the genotype 2, and cause acute disease, mortality rate in 100%. And as I mentioned, in Vietnam, we detected many gene-related strains, very low vigilance, called chronic disease. So we don't worry about the high vigilance strain, because when the high vigilance strain enter the farm, clinical signs shown very early, so we can detect very soon, and then we can apply any prevention method. But in case of low vigilance, the same strain as I mentioned, some farms they clinical signs, sometimes not. So very hard to know if the virus enters the farm. So people worry about the low vigilance strain. As I mentioned during my observation, clinical signs also depend on the area big. So my observation says that when the virus enters the farm, the sow and the boar always have a first clinical sign, and then fattening big, and then piglet. And clinical sign, as I mentioned, fever is most clinical sign, typical clinical sign. But when the pig gets a fever, so there is a viremia. Viremia is means the virus load very high, but no clinical sign, no viremia. So it means no viremia. So it means if the pig is healthy, and then it collects the whole blood for ASF detection, I'm sure it will be negative. So you just focus on the fever one, and then take the whole blood, very suitable sample for early detection. So here's the last sentence. Early detection removal, along with a strict biosecurity measure, is very key method to prevent the ASF spreading and control the ASF in Vietnam. So before ending my presentation, I'm lucky to say that I have many international collaboration. I have my research lab at university, already more than 10 students working with me in the lab, including PhD, master, and undergraduate. And luckily, I also have my own company. We provide diagnostic service to the community. Of course, I have many international with Canada, US, America, and Korea. Yeah, many scientists. So here is my message. We are different gap, so nobody know all. Collaboration very important. Yeah. Thank you so much for your attention. Thank you.